Currently, in both the House and the Senate, the relevant committees are addressing workforce shortages and current personnel. This is going to be even more of a prevalent issue with the expansion of coverage that's being proposed in all the committees of jurisdiction. Currently included in the proposals in both the House and Senate are programs to address workforce issues and healthcare personnel. Currently, in the current iterations of the bills, occupational therapy would be covered under the auspices of allied health professions. In the House version, there's inclusion of the frontline provider grants to provide loan repayment and funding for practitioners, including occupational therapists. Occupational therapy is going to be, key to meaningful changes in the healthcare reform system, and to effectively implement these changes, we're going to have to address workforce issues in these critical areas, including occupational therapy. AOTA is currently working with all the relevant committees for the specific inclusion of occupational therapy outside the umbrella of allied health professionals. We think we play an important role, and we are an area that needs to address workforce issues and want to work for the specific inclusion in any bill that moves forward in the House or Senate. So that's where we are with workforce issues, and we urge you to strongly advocate for specific inclusion of the profession in any of these proposals. The next is an issue that we've been working on for many years now. It's the occupational therapy's role in home health settings. We are working on initiatives in both the House and Senate that would make occupational therapy an initiating service in home health settings. In the House, we once again have the Medicare Home Health Flexibility Act introduced, HR 1094. It was introduced by our long-time champion, Representative John Lewis, a Democrat from Georgia, and Lincoln Diaz-Balart on the Republican side from Florida. This would allow occupational therapists to open cases and conduct the initial comprehensive assessment for Medicare home health beneficiaries when OT is included in the physician's order with another skilled service. With this issue, we are working on strategies in both the House and the Senate to have the intent of the language from HR 1094 included in the healthcare reform proposals moving forward. On the House side, we are working with the Energy and Commerce Committee and the Ways and Means Committee to try to have this language included in the manager's amendment. This is when the three committees of jurisdiction merged their bills to bring to the House floor. We are working with our champion John Lewis, committee staff from both Energy and Commerce and Ways and Means, and the personal staffs of a number of offices from representatives who sit on the relevant committees. On the Senate side, we are working with Senator Ben Cardin from Maryland and others to have the intent of the language of HR 1094 introduced as an amendment when the Senate healthcare reform proposal is introduced on the floor. We're also working to try to have it included as an amendment in both the Finance and Health, Education, Labor, and Pensions committees. This is a unique opportunity for us to have this language included. We've been working hard up here on Capitol Hill, and your advocacy could help us to push this forward and finally have resolution to this issue that we've been working on for so long. If you have any questions today or in the future, please feel free to contact your federal affairs staff here at AOTA. Christina Metzler, our Chief Public Affairs Officer, Tim Nanof, our Federal Affairs Manager, and myself, Legislative Representative. We'll be available to answer any questions today or in the future regarding any issues or concerns that you may have.
Thanks for coming. Thanks for coming today. Just wanted to send you off on this note that lots of people are in fact counting on the advocacy that you all are going to do on Hill Day. Thanks for coming. We look forward to seeing you on Monday, October 5th.